The cervical spine, the uppermost part of the spine, consists of 7 vertebrae, C1 to C7. These smaller, more mobile vertebrae allow for a wide range of movements. The atlas, C1, supports the skull, while the axis, C2, enables head rotation. The cervical spine supports the head, which averages 10-12 pounds. It facilitates various head and neck movements, including rotation, flexion, extension, and lateral bending. Additionally, it protects the spinal cord and nerve pathways, ensuring communication between the brain and body. Proper alignment of the cervical spine is essential for optimal function. Maintaining its natural curvature prevents stress on muscles and ligaments. Misalignment can lead to chronic neck pain, stiffness, headaches, and nerve compression, causing tingling or numbness in the arms and hands. Misalignment can result from poor posture, especially prolonged forward head posture, injuries like whiplash, degenerative changes such as arthritis, and repetitive strain from activities involving frequent neck movements. These factors can disrupt the cervical spine's alignment and function. To maintain cervical spine health, create an ergonomic workspace with a monitor at eye level and a supportive chair. Regular exercises and stretches improve flexibility and muscle support. Chiropractic checkups can realign the spine, alleviating pain and enhancing mobility.